So we will continue with the diet in obesity and underweight chapter from the strategies of weight management, the strategies of weight loss. Those who have the textbook, you can mention the page number in the chat box. I don't have the textbook on me right now. Page 317. So the first strategy is diet therapy. Okay. You can see the textbook, which page number is the diet therapy topic. So diet therapy usually, even if a person is overweight, okay, even if a person is overweight, the diet therapy for weight loss is is focused on making sure that you are in a calorie negative state. It is very important. Okay, people who are overweight, obese, okay, everything starts with a diet therapy. And even for certain people with health conditions like diabetes, PCOD, PCOS, okay, diet therapy for weight management and weight loss is very important. Okay, and this diet therapy can be given by any registered dietitian. Okay, so you will have to set when you are putting a client in a diet therapy. First of all, as a nutritionist or as a dietitian, you have to look closely at what is the eating habits of your patients or your clients. Okay, and you have to be with them in setting new nutritional goals. Every month, the nutritional goals will change based on how much weight they are successfully losing. Okay, we will see that later using a formula. We will see that later how you have to put a new goal every time. A goal in the sense a calorie goal. Okay, and your client also have to be regularly in touch with you to track the progress of your client. Okay, and whatever weight goals or weight loss goals you are setting, it has to be realistic. Okay, you can't claim or you can't sell your business stating that you will help lose 10 kg within a month. It is not realistic. Yes, people can lose 10 kgs within a month, but it is not a safe approach. Okay. So your weight loss goals, along with your client, when you are discussing the loss goals, it has to be realistic. Okay. Majority of the people, they should usually just target of losing about 1 kg per week. Okay. 1 kg in 2 weeks. Like these things are realistic goals. And if the weight is too much for certain clients, it is important that before any surgical procedures, okay, certain disease conditions, like if the weight is too much, your health problems will also increase, and that will not give you a successful medical treatment as well. Okay, so these conditions are like diabetes, arthritis, high blood pressure, heart disease, stroke, sleep apnea, liver diseases, infertility issues, lung diseases, certain cancers, mental health problems. In these conditions, it is difficult for weight loss. Okay. And if weight loss is not achieved, the clinical treatment that they're taking for these specific disease condition, that will also not work. Okay. So weight loss and the clinical medical treatment goes hand in hand. Okay. So diet therapy, there are various points, like you should be on a calorie deficient diet. You should burn more than what you eat. That is calorie deficient. Okay. If you're eating, let's say 1,500 kilocalories, okay, on a daily basis, but you should be burning around 1,800 kilocalories. That's how you will attain weight loss. Okay. There is no magic pill. There is no magic drink. Okay, there is no lemon in hot water, apple cider vinegar in hot water drinks that will help in weight loss. The only thing that can help you in weight loss is being in a calorie deficient condition. Okay, in which your body, along your body means your basal metabolism and your activities, these together are burning more calories than what you consume. Only when you attain this state, okay, of lifestyle, you will successfully be able to reduce weight. Okay, so that is the goal of diet therapy. Is it clear to all? Lots of points are mentioned in your textbook, very easy to understand points that you can just read later. Okay, that is for your self study. So physical activity, the first and the foremost reason of weight loss will be your diet. 70 to 80% weight loss can be achieved only with diet. The remaining part is the physical activity. Okay. If you are physically active, the exercise, the exercises that you engage in, the physical activities that you engage in, it accelerates your weight loss. That is what physical activities do. Diet alone can also give you weight loss. But if you want a faster, the more healthier way, and a weight maintenance strategy as well, if you're looking for these areas, you have to include certain degree of physical activity. Okay, for fat burning purposes, for fat burning, weight loss comes under various categories. Do you just want to lose the fat content in your body? Do you want to lose fat and gain muscles? Okay, or do you want to maintain the weight that you have lost? These are various categories. So we usually start with fat loss. Okay, you're not focusing on gaining muscle sooner, but you're just focusing on whatever additional fat percent you have in your body. Okay, you just want to get rid of it. Okay, so uh, low intensity exercise for a longer period of time, that will give you fat loss. For example, walking. People usually say that walking does not have any weight loss benefits or something like that. It's not true. Okay, because when you walk for 1 hour, 1.5 hour, okay, within the first half an hour or within the first 40 minutes, you have exhaust your glycogen stores, glucose stores that is present in your body that has been exhausted. Now, what is remaining for the energy? Fat. Okay. Next, in the next 1 hour or next 45 minutes, your body will be burning the fat for energy. Okay. That is how, if you are consistent with your walking schedule, okay, you will see a consistent decrease in your weight loss. And this decrease is the fat loss. Okay, walking may not help you gain a lot of muscle mass, but it will definitely keep you it will definitely help you to keep those extra fat out of your body. Okay, walking is a great fat burner exercise. Okay, anything that you're doing for 1 hour or longer, and it is not high intensity. Okay, it is moderate intensity, like brisk walking is moderate intensity. That can help you burn your fat. Okay, and then comes the second stage in which you want to gain some muscles so that your body, even if you're resting for a few days, if you're not doing any exercise, you have gained some muscles. That lean muscle on its own can burn energy. Okay, can keep the weight off your body because lean muscles require more basal metabolic rate. Okay, so the next stage will be to gain more muscles. Okay, and this is where you have to add some resistance in your training. Okay, like some weight lifting using dumbbells. Okay, and even if you are using a treadmill on an inclined position, okay, on an inclined position you have to use treadmill. It should seem like you're trekking. Okay, because when you're trekking, you're going uphill, the body is fighting against gravity. Okay, gravity, using gravity in your the force of gravity, using that as a resistance can also help you build more muscles. Okay, so even if you just want to walk, you don't want to go to any gym, or you just want to walk, Okay, choose areas where there is a slope, okay, and climb up the slope. That can give you more resistance, and that can also help you strengthen your muscles, build more muscles. Okay, now you have built the muscles, you have lost weight. The third stage is maintaining that lost weight. You don't you People who have lost weight have also the highest risk of gaining back those lost weight all over again. Okay, so keeping that weight loss in a continuation, maintenance in a continuation, you have to follow a strict diet. You have to be in a calorie management. Now you don't have to be in calorie deficit. If you have lost the weight, keep your calories in a maintenance protocol. Okay, keep your be regular with your physical activities. That will help you balance your weight. Okay, that is the use of physical activity. Physical activity is a very targeted approach based on what exactly you want to lose, what you want to gain, what you want to maintain. Okay. If you already have arthritis, okay, knee problems, and see, first try to lose your weight and then go for resistance training and all. Okay, because if you're obese, obviously you have a lot of weight that your knees have to bear. Okay, and if you are using certain um inclining positions and all in treadmill, that can cause harm if your posture is incorrect. Okay, if your knees and ankles are they carry most of the weight of your body. Okay, so it's better to lose few kilos just by diet, and then when you see your body is lighter, then you can go into this resistance stage so that you are not harming your knees. Okay. So first, burn off the additional fat just by diet and just by moderate intensity exercise, and then slowly you can add more resistance. Resistance can be added slowly. Okay. Then stress management. Increased, see, when you are stressed, your body produces a lot of cortisol. Okay, your adrenal gland produces a lot of cortisol. If you see this hump people have, if the back of your neck, the upper part of your shoulders, you see a hump. Okay, people naturally people also tend to gain weight there. Also, there is a hump that is formed. That is a sign that you have cortisol. Okay, cortisol, you have high cortisol level. Your abdomen is protruding, even if you're not much into alcohols or you don't drink beer. Okay, but still your abdomen is protruding. That is another sign of high cortisol levels. Okay, you're getting a lot of acne. You look much older than you are. Okay, these all are effects of high cortisol. It also causes the risk of diabetes. Okay, for high cortisol level can also lead to insulin resistance and diabetes. So stress management is very important. Okay, people can put on weight just by stress, because high cortisol levels will not allow them to feel full after having food. They will frequently have this hunger pangs. Okay. The body will, when the body is stressed, the body uses up a lot of energy, and body thinks that we don't have enough energy. We have to eat more. We should be hungry. We have to eat more to get more energy. So that is the situation the body faces when you are stressed. Okay. So stress management has to be done. You have to chill it out. Okay, find some activities, find your hobbies. Okay, take a vacation. If your workload is if your work is giving you a lot of stress, take a vacation, take a short break, because nothing is more important than your health. Okay, no amount of time or money can replace your health. Okay, so stress management activities at work, at home, as a family, as a group. Okay, it should be one of your major priority, especially if you are in certain urban cities like Mumbai, Delhi, Bangalore. Okay, stress levels in inhabitants of these cities are much, it's off the roof. Okay, as compared to any person who is from a relatively small town or a laid back lifestyle. Okay, so see where, which kind of city you are, what kind of uh, work portfolio you have. Okay, how can you inculcate some stress management activities? It is very subjective. Okay, stress management is like, it is very subjective. You have to find out what works best for you to get your cortisol levels to calm down. Okay, then pharmacotherapy, that we will not discuss in detail. This is for those who have are from a medical background. They can read the pharmacotherapy, certain medications that are used. So basically, the mechanism of action of medications used in weight loss, it's to suppress your appetite. Okay. Some medications like L-carnitine supplements and all, they are supposed to burn fat more, but we don't have any suggestive evidence yet. Okay. But appetite suppressors are used, and people who have undergone some bariatric surgery, they will also be put on some pharmacotherapy after post weight loss. Okay. So usually to suppress your appetite, to make you feel full. Okay. Certain hormonal therapy can also be used if you're not producing enough amount of leptin or ghrelin hormone. Okay. This hormonal replacement therapy can be used if you're dealing with issues like hypothyroidism. So definitely levothyroxine medication. Okay, they all come under pharmacotherapy. Nowadays, metformin is also used, and in Western countries, Ozempic is a drug. All the Hollywood celebrities are on Ozempic. Majority of them. Okay, they take this drug that will suppress their appetite. Okay, Ozempic is a drug that suppresses the appetite, and they get drastic weight loss. They undergo drastic weight loss within few months of on being Ozempic. Okay, actually, Ozempic it was invented to control diabetes, but weight loss, accelerated weight loss, was also seen in because of this drug, and now it has become a weight loss drug. But actually, Ozempic was used for diabetic patients. Okay, metformin. Metformin is also has certain weight loss benefits. Okay, anti-aging benefits, weight loss benefit. Metformin is used again in diabetes. Okay, so diabetic drugs, kind of Ozempic, metformin, they also have this side effect of weight loss. Okay, and the industry, pharmaco industry, is using weight loss, which is a side effect of this drug, as a mainstream promotion for these medications. Okay, so pharmacotherapy, the drugs we will not discuss in detail, because as a dietitian, you are not supposed to prescribe any of these drugs, but you should just have a general awareness of these drugs. Okay. Then behavioral therapy, psychotherapy, behavioral therapy. So people who suffer from um, food addiction. Okay, bulimia nervosa, certain food addictions, eating disorders. Behavioral therapy is more suited for them. Okay. Um, One of the strategies used in behavioral therapy is people who suffer from the same kind of disease conditions. Okay, it could be any eating disorder. Okay, all those people are allowed to meet, have a group session. Okay, uh, so with that, they can exchange what they have learned about their own condition. Okay, because a person who is suffering from a disease condition can only will be able to understand the other person who is going through the same situation. That is the technique that is used here. Okay, so whatever they have learned about themselves, what caused this situation, what is improving their health, these tips and tricks they can exchange with each other. Okay, so that is the focus of behavioral therapy. And people who have food addiction, okay, they also will be put under certain strategies like wearing a rubber band on their wrist. And whenever they feel like they want to eat food, they have to just tick off the rubber band, so that they get slightly, they feel the pinching pain of that rubber elastic hitting their wrist. Okay, so that will distract them from the addiction. Okay, that will distract them from the urge of having food. Okay, so these kind of tips, tricks are used in behavioral therapy. There are various other techniques used. Okay, psychotherapy, behavioral therapy is done. So in some cases, hypnotherapy is also used to suppress the hunger. Okay. Then weight loss surgery, bariatric surgery, there are different strategies in this. Okay. Uh, Gastric bypass surgery, resection surgery, a section of the stomach is removed. In bypass surgery, a section of the stomach is not removed, but from esophagus, a direct connection is made to the antrum of the stomach. So the food will not stay in the main part of the stomach for the long time. It will immediately empty the stomach. Okay. So there are different strategies used in weight loss. Okay, based on weight loss surgeries, what kind of surgery will suit the patient, their eating habits more. Okay. So in diet therapy, the focus should be low calorie diet. If it is, usually it is less than 800 kilocalories for obese patients and people who have undergone some bariatric surgery, it is less than 800 kilocalories. Any diet that is less than 1500 kilocalories, you will have to take vitamin supplements. Vitamin and multimineral supplements have to be taken. Okay. Reducing the diet, the portion size, portion control has to be done. So portion control is a habit that you have to learn. Okay, nobody can do this for you. You yourself has to learn how to control the portions, how to understand to what extent the portions are healthy, and if you cross that line, how it becomes unhealthy. You will have to do a lot of trial and error to understand that. Okay, so that is reducing the diet. Then energy deficit calculation, we will do that calculation in a while. There is a formula, the St. John and Mifflin formula. I'll give you an example. So make sure you have a calculator or a paper or pencil with you so that it's easier for you to understand how we do the calorie calculation. So this is the formula. So you can take out a calculator in your mobile or a piece of paper and pen. If when you're ready, just type ready in the textbook. Sorry, in the chat box. So note down this matrix. Okay, age is 30-year-old, female, gender is female. Height is 164 centimeter. Weight is 69 kg. Okay, I have mentioned this in the chat box, and has a sedentary lifestyle. Before you jump into the calculations, please make sure you are following the board mass technique. On screen, you can see the board mass techniques. Okay. First, you have to solve the brackets. What is inside the bracket? Then, if there is any cube root, square root, okay, square, cubes, that you have to solve. Since the formula does not have any square or cubes, you can leave that. Then division has to be done. Again, the formula does not have the divisions, so you can leave that. Multiplication, it is already happening in the bracket that you have already done, so leave that as well. Then you have to add, and finally you have to subtract. So please follow this order, otherwise you will get, everyone will get some other answer. Okay, please follow this order of operations, board mass order of operations. Okay, that's a rule of mathematics. First, solve what is inside the brackets. Since our formula does not have these three elements, orders, division, and multiplication, outside the bracket, it is not there. So leave that. Okay. And addition and subtraction. So in this order, you have to do. Okay. So first you have to, so this is for a woman. Okay. This for men, a slightly different formula is there, in that you are just adding, you just have to add +5 here. But just right now, just for this tools calculation for a woman. Only step one. Just do step one and give me the answer in the chat box. So step one, what is the answer that everyone got? Yes, the correct answer is 1404, 1404. Okay, 1404. Now let's decide what this client has to achieve. Okay, I have just given you these indices. I have given you the person is sedentary lifestyle. It's a female, height, weight, and age. Okay. But what should be her goal? Should it be weight loss, weight gain, or weight maintenance? How will you conclude that? How will you conclude that? Yes, doing the BMI. So do the BMI and give me the answer in the chat box. I hope everyone knows the BMI formula. Weight in kilograms, height in meter square. So 164 is the height. You have to convert it into meter. So it will be 1.64. Meter square means multiply it with 1.64 again. Okay. So what is the BMI of this person? Yes, it is around approximately 25.7. Okay, 25.65. So just round it up, 25.7. So what do you think? According to the BMI of this person, is she healthy, overweight, obese, underweight? What would you conclude here? Yeah, she is borderline healthy. Okay, she is borderline healthy because we don't know what a BMI can give you if a person is underweight, healthy, overweight, obese. This thing the BMI can let you know. But what are the factors that you will not come to know from BMI? Can we know that does she has more fat in her body, or does she have more lean muscles in her body? Because that also We don't know yet. Okay. So this is where your client's subjective, okay, your client's subjective thought process will come into play. You have the you now know the basal metabolic rate of this person. Okay, that the first step that we did just was to find out what is the basal metabolic rate of this person, which means this female, even when she's not doing anything, any work, she's sleeping, resting, she's just not doing any activity, but still her body is capable of burning 1404 kilocalories on a daily basis. Okay, without doing anything, just by resting, sleeping. Okay, her the body is burning this much calories on a daily basis. Okay, we don't know her medical condition, we don't know her muscle mass, we don't know what is the fat concentration in her body. Okay, does she is her weight because of some swelling, is it because of some water retention? We don't know yet. So this is where you talk to the client. Okay, what do they want? So this is your weight, this is your height, this is your BMI. Your BMI is saying that you are borderline healthy. Okay, you're not in a bad situation health wise. But what do you want? You have to ask the client. The client themselves will tell you, see, I used to look like this, I want to go back to my old figure. Okay, my weight was around 57, 58, something like that few years back. I want to reach there. Okay, so these would be the discussions usually the client will give you. Okay, so now if this lady says that when I was, she is now 30 years, 30-year old. Okay, she may say that when I was in 12th standard, I was around 50 kgs, I want to go back there in a year. Is it possible? I want to get my school, the kind of body which I had in my school. Okay, school days, I want to get back there within 6 months or in a year. I want to get back there. It's not possible. Okay, because when she was a teenager in her school time, the bone mass was completely different. You will definitely be much heavier than that because your bone mass the skeletal bones have not accumulated its correct weight yet. Okay, it takes around for Indians, for Indian citizens, by the age of 25, we know exactly how much bone mass is there, what is the bone density you will carry throughout your life. Okay, so there are a lot many factors that will prevent you from reaching that particular weight. Okay, so if the client has given you an unrealistic goal, it's your duty to correct that, correct certain myths and certain notions your client might have. Okay, you have to check if the client is suffering from some body image issues or not. Okay, if the client has body dystopia, it's a body image issue. Okay, then you may require some psychiatric help as well in this client situations. Okay, so these many factors you have to rule out. So you have to give them a realistic weight loss plan. Okay, so based on, if you remember the previous screenshot, okay, now we know that this person is around 164 centimeter. Okay, the BMI is around 25.7. If we go back to our previous slides, we have discussed some. Sorry, if you remember this chart, is my screen visible? Is my screen visible? So based on the height, okay, this female was around the height of 164. Okay, it's between 162 to 165. Okay, so her weight is around 164. So let's take the 5 feet 4 inch category. She will come under 5 feet 4 inch. Okay, so what weight range, if the client says, I want to go back to the 50 weight, 50 kilograms weight, but realistically, if you say, if you look at it, if you look at this chart, uh, 50 kg is still a healthy, it's still a healthy category for a 165 feet 4 inch person. But based on her age, based of the factors involved in her weight gain, it is not realistic to go back to the 50 kg. Okay. So what will you advise here? What weight range would you look at this chart and advise? You can use this chart for your client as well to show them this is your height and this is your weight. Okay. Her weight was around 69, almost 70. Okay. So obviously, she is in the slightly overweight category. Okay. Slightly 25.7, slightly overweight category. Okay. So what would you recommend for this person? Okay. To how much BMI she should ideally have? What is the cutoff point? Don't lose more than this weight. You have to maintain, you should only be under this range. What do you suggest just by looking at this BMI chart? And also consider this is a female. Consider this is a female. So here, for females, it is ideal that their body mass index should not go below 20. Females should not go below 20 in their body mass index. Okay, so she can be around 21 to 24. So if you see this 21 to 24 category, what are the weight that you can tell approximately to keep the client in 21 to 24 category of healthy BMI? What weight range would you prescribe? Women should not go below 20. BMI of the woman should not go below 20. It means there is an accelerated fat loss, and too much of fat loss in women could lead to infertility issues. Okay. Yes. From 55 to 62 or even 63, that is the ideal weight this woman should maintain. Okay. So this is how you have to tell your client that the 50 kilograms target that you give is kind of unrealistic. It is also unhealthy. But for your health, for your fertility, and other factors, okay, this woman is just 30 years old. Okay. She is in the peak of her fertility in her reproductive age group. Okay. So you can't give her some extensive diet that will crash her fat loss more than 10 or 15 kgs in a year. You can't put the woman through that. Okay, because that will definitely affect her menstrual cycle. That will affect her fertility. Okay, we don't know that, we have not given you any inputs regarding her marriage, or does she want to have children. Okay, or she is, or if she's already a mother, we don't know all these factors. Okay, but we have to make sure for women's health, a healthy menstruation cycle is important, irrespective of she does she wants a child, or that is her own choice. Okay, that's her personal choice, irrespective of wanting children, not wanting children. Okay, setting a timeline for having children. Okay, irrespective of all those things, as a dietitian, as a nutritionist, you should make sure if you are dealing with a female client, her menstrual cycle to be regular is very important. Okay, it is very important. So you cannot mess around with that. Okay, so giving this client an ideal weight range, that see 69 kg, you are overweight. You definitely have to reduce a little bit of weight, but this is the ideal range for you. Okay, 55 to 62, that is a healthy range. Okay, you can lose 9 kg in a year, you can lose 10 kg in a year, that is completely fine. And even if you put 2 3 kilograms more, you don't have to fret about it a lot. Okay, you can still be calm, you don't have to stress about it. If you just gain 1 or 2 kgs additional extra, you don't have to strain much about it, because first of all, she's a woman. Okay, in different stages of the menstrual cycle, your weight is going to be different. Okay, when you are menstruating, or just now your periods have got over, you will feel much lighter, your weight will be just 1 or 2 kilos lower. Okay, but after ovulation, after the ovulatory phase, when in 2 weeks you are going to get your periods, when you are in that stage. Okay, your periods will come in the next 2 weeks. That's a time period you will see a lot more water retention in your body. Okay, a lot of swelling here and there. You will feel uh, you will have food addictions, you will have a lot of appetite. Okay, and you will obviously retain a lot of water in your body, so definitely that will affect your weight pattern. Okay, so on a monthly basis, a woman's weight will shift. Okay, because of her hormonal changes. So it's very important as a dietitian to acknowledge that, to note these factors and give a realistic advice. Okay, so based on her activity, she has a sedentary lifestyle, little or no desk job. So now you know her BMR. Her BMR from the step one calculation. You know that, see, if there is too much of water weight in your body, you may be having a lot of salty food. Okay, you are having a lot of packaged items, processed items. Naturally, there is high sodium in that. Or even if you're just having the home cooked item, control your salt intake. Okay, you will see your water retention is also going down. Okay, sodium plays an important role in retaining water in your body. So reduce the sodium content in your food. Okay, go for low sodium diet, you will see the change. Okay, so now we know the BMR of the person. It's around 1404 kilocalories. Okay, her activity level is sedentary, no physical activity. So what is the number that you will choose? 1.2. Physical activity level is 1.2. Okay, now you have to multiply the BMR that you found, multiply that with 1.2. See what answer you get. What is the answer that you get? Yes, 1685, 1684.8, 1685, round up. Okay, so this is where you have to stop. If your client is in an ideal weight category, if the client is in a weight management state, I don't want to lose weight, I don't want to gain weight, I'm happy where I am. Okay, so you have to stop at step 3. If that is the client, if that is what your client has requested, you have to stop at step 3. Okay, so in this in that kind of situation, when the client says I want to just maintain my weight, this is the final step. Whatever you get here should be the calories this person should be having. But in this situation, we have advised our client, based on the example that I have given, we have advised the client that she should reduce her weight. Okay, so you will require a step 4. So subtract 300 to 500 kilocalories from what you have got here. Okay, 1685. So when you're making a diet plan for her, okay, for this client, will you immediately subtract 500 kilocalories from her diet? What will be the ideal strategy that you will use here? Now you know that 1685, you have to reduce some from that. Okay. You have a range 300 to 500 kilocalories you have to subtract from this number. Will you immediately take away 500 kilocalories or will you try a tapering effect? Yes, you have to reduce 300 first. Okay, right. Start reducing a little bit first. Get the patient's body get used to that reduced calories. Then slowly increase the calories that you are reducing. Okay, that is the situation you have to follow here. So what will be the calories you will suggest here? 1684, 1685 was the calorie that we got in step 3, minus 300. What is the final calorie that we will suggest this patient, sorry, this client? Yes, 1385. Now, when you give these kind of numbers, 1385, okay, it is difficult for the patients to track. Okay, so ideally we will say you should not go beyond 1400 kilocalories. Okay, you have to round that up. Okay, don't go beyond 1400 kilocalories. Stay in that lane. 1400 kilocalories is your upper limit. Okay, 1300 kilocalories is your lower limit. So please stay between 1300 to 1400 kilocalories on a daily basis for the next 2 weeks. Okay, in every 2 weeks you can check the weight. Every 2 weeks check the weight and see how you are performing. Okay, and if there is a weight loss, because there are different factors that plays in weight loss. Okay, so with this calorie deficit, if there is a weight loss, if you have lost at least 2 kg in 2 weeks, okay, do you have to do all these steps all over again? Just imagine, from the next day onwards, this client has started, she has put herself through this 1400 kilocalories diet. Okay, after 2 weeks she comes to you, she has lost around 2.5 kilograms. Okay, so what will you do? Now her new weight would be around, it was 69, now her new weight is around 67. So will you calculate all these things again? Here you can go with 2 ways. Okay, even though she has lost the weight, don't change the formula. Okay, don't use the new formula, because remember, she has just reduced 300 kilocalories and she has lost some weight. Okay, you have to yet reduce 400 kilocalories, 500 kilocalories as well. Okay, so make sure in 1 month, from 300 to 500 kilocalories reduction has been attained from just calorie reduction. Okay, you don't have to change the formula again and revisit what new calories you can give. No need for that confusion. In 1 month, target that 300 to 500 kilocalories has been reduced from her diet. Okay, that should be the target. After 1 month, see how much, what is the gross weight that she has reduced. Then you will calculate the formula again with the new weight and see what else we can do. Okay, what should be her weight reduction or weight maintenance? Is it clear to all? Now you know how to do the calorie calculations. For heavy exercise, it is 1.7. If you can see on the chart, it is 1.7. So other principles that we can follow in weight loss. Okay. So if you don't want to go through all these, remembering the formula, her weight, taking the weight, height, okay, all these things into consideration, the next thing that you can do is 20 kilocalories per kg body weight. You can follow that strategy. Okay. So based on the person's indices that I have given, this lady was 69 kilocalories. Sorry, 69 was her weight. So based on that, multiply 69 by 20. What is the answer that you get? It is 1380, which is almost similar to what you have got from doing all those calculations. Okay, 1380. Okay, while doing those calculations, you got 1385 something. Okay, it's just a 5 calories difference, but it is almost similar. Okay, you're almost getting the similar pattern. That is much more ideal because you know the BMR of the person. Okay, you know the activity level of the person. Okay, this is a more general approach. 20 kilocalories per kg body weight. If this is your intake on a daily basis, you will achieve weight loss. This is for weight loss. Okay, this is not for weight gain. This is not for weight maintenance. This 20 kilocalories per kg body weight approach is only for weight loss. Okay, 0.8 to 1 gram of protein per kg body weight should be taken, also based on your activity levels. Okay, go for complex carbohydrate food, low glycemic index food. Okay, even fruits that are not that sweet, that are not too ripe. Okay, the more ripe a fruit is, more level of fructose it has. Okay, so the more fructose a food has, its glycemic index will be high. Okay, so go for complex carbohydrates, low glycemic index food. Okay, so with for example, add more millets in your diet. Skimmed milk is much better as compared to full fat milk. Go for skimmed milk because it does not have trans fat, no saturated fat. Vitamin A and D supplementation will be required because any calorie deficient diet, you will require multivitamins. Okay. Protein powders, multivitamins, these will be required. Okay. Limit your dairy to limit calcium because too much of calcium could also have some negative implications in your weight loss. Okay, it functions as anti-nutrient as well. It can form some precipitates which will not allow the absorption of good quality nutrients. Okay, a glass of warm water before meal is ideal. And when you start your meal, start having high fiber meals first, and then go to protein, then to carbohydrate. Okay, for example, if you're having your lunch, first have the salads first. Okay, finish the salad first, then have your protein based what options that you have. If it is paneer, tofu, okay, chicken, whatever is your option of protein in that meal, finish that. Then have the rice with some a vegetable curry or dal. Okay, what dal and rice is also carbohydrate rich. Okay, so you can go for that at the end. So if you follow this thing, your blood glucose level will not be high. Okay, your the insulin spike will be very low. Okay, it will not be that high. So always start your meal with fiber. Drink a glass of water. After 5-10 minutes, have your fiber based meal, and then go for protein, then carbohydrates. At night, don't have carbohydrates. At night, just have fiber based meal or protein rich food. Okay, protein and fiber should be at night, dinner. Carbohydrates, you can indulge in carbohydrates during your lunch time. Okay, or any time between 11 a.m. to 2 p.m., 11 to 2 p.m. This is the time when your blood circulation is at high speed, your blood pressure is also high, your metabolism is also high during this time of the day. Okay, 11 a.m. to 2 p.m. Okay, in this time of the day, your metabolism is the highest. So in this optimum time, you can indulge in carbohydrates. Okay. Pharmacy supplements like sibutramine, orlistat, these are used for appetite suppressing. These are appetite suppressing agents. Okay, only under prescription you should be using this. As a dietitian, don't prescribe this to any clients. So these are the principles of weight loss. Gastric bypass surgery. You can see here one example. Um, you have cut off this fundus part of the stomach, body of the stomach, okay, and directly you're connecting the esophagus, the end of the esophagus, a little bit of the stomach portion that has been connected directly to the jejunum. Jejunum is the second part of your, it's the second part of your small intestine, okay, and duodenum will be connected to jejunum anyhow, but from the stomach also directly certain things go directly into the jejunum. So here bypass, what are you bypassing? You are bypassing the stomach hydrochloric acid. Okay, so whatever food you have after having this bypass surgery, whatever food you have, it should be hydrolyzed food. Okay, the patient will be put on some formula based meals, which is hydrolyzed, because now you know the food will not reach the hydrochloric acid. Okay, so hydrolyzation will not take place. So hydrolyzed formulas are fed to the patients who have undergone bypass surgery. Okay, from the duodenum, bile, salt, pancreatic juices, okay, those things will enter the jejunum. It will get mixed in the jejunum. It will get absorbed as well. Okay, so you can see here this green arrow, it is the digestive juice that is secreted by the pancreas, by the liver, which is secreted into the duodenum. Okay, since the food is not arriving the duodenum can still give these digestive juices to the jejunum. Okay, but food will directly enter jejunum, not the stomach. So this is one example of one type of gastric bypass surgery. Okay. So complications of obesity, physical activity, they cannot, even if they do some physical activity, they get tired fast. They will get breathless. Okay, they will hyperventilate. Even if a flight of stairs, if they are climbing, they will hyperventilate. Okay, their lung capacity is very much reduced because of obesity. So physical activity, they are not able to do physical activity because of this hyperventilation. Then metabolic disorders like diabetes, insulin resistance, okay, are very common with obesity. Okay, in India, you don't have to be obese to get diabetes. Even being slightly overweight or lean, you are at the risk of getting obesity. But in Western countries, diabetes is more common in obese people only, not in uh, underweight or healthy people. Okay, so these kind of metabolic disorders, inflammatory disorders are also associated with obesity. Cardiovascular disorders, the risk of heart blockage, plaque, atherosclerosis, varicose veins. Okay, these also increase with obesity. Sleep apnea, obese people, if they lay straight without pillow, they will not be able to breathe properly. They will become breathless at night. Okay, so they will require a support of 2-3 pillows to keep their head and neck up, okay, in a semi-cardiac position. Only then they can breathe properly while sleeping. And if they don't use pillows, they lay straight, they cannot breathe. Okay, that is sleep apnea. Then they are prone to accidents, clumsiness, okay, GI disturbance, either constipation, diarrhea, okay, issues, colon issues, IBS syndromes. Then osteoarthritis, as I mentioned earlier, the more weight you carry, your knees and ankles, which are the weight-bearing joints of your body, they bear a lot of weight. Okay, the more heavier you are, uh, the knees and the ankles tend to become sore because they are carrying a lot of weight and they're constantly in motion as well. Okay, so that will put you to at the risk of developing osteoarthritis. Then obstetrical risk during pregnancy, obese women, okay, it is a high risk pregnancy, like underage, teenage pregnancy, women who are obese, okay, women above the age of 35, these all come under high risk pregnancy. Okay, with obesity, the risk of the pregnancy complication also increases, like developing eclampsia, preeclampsia, pregnancy induced hypertension, gestational diabetes. Okay, these things are very common among women who are obese or overweight during pregnancy. And psychological disturbances, these are body image disturbances. Body image issues, okay, body dystrophia, so dysmorphia. So these things are very common among obese people. It affects their socialization. Okay, they isolate themselves. They don't want to be seen in public because they don't feel confident in their own body to meet others, to socialize. Okay, to take part in social events. So there is a tendency of social isolation. Okay, isolation related psychological disturbances, depression, anxiety, stress. Okay, these things will follow. Then low life expectancy, like the above disorders, if we have this, like diabetes, cardiovascular diseases, if and also obstacle complications and all. Okay, if these things keep on happening among a group of obese people, definitely it will impact their life expectancy. Okay, the more obese you are, the high tendency that you will die before your age. Okay, before your peers. In cancer, especially colon cancer, because obesity causes a lot of inflammation in your body. Okay, chronic inflammation could lead to cancer. Then weight management guidelines for dietitians. You have to determine certain nutritional factors that I mentioned, like do the BMI. Okay, when see what are the realistic goals that you can set for your client. Okay, ask their family history, medical history, health history. These things you have to identify first before giving them any diet plan, diet chart, before jumping into the calorie calculations. These many things you have to determine. What genetic, do they require a genetic counseling? Okay, is their obesity genetic, or is there any genetic condition that is leading them to obesity? Okay, these things you have to determine, then decide with the client. Okay, the decision is along with the client. It's a client centered decision making that you have to do. Okay, you have to decide along with the client. Both of you have to come to a conclusion. Okay, this is the ideal weight where I should reach within 6 months. Okay, within 4 months. Okay, within this 1 month my target should be to reduce 2 kg. By next month, total weight reduced should be around 4 kg. So like this, realistic goals you have to decide with your client. Then you have to apply in applications. This is where you give the principles, guidelines, what to do, what not to do. Okay, for weight loss or weight management. Okay, avoid these food, add more of this group of food. These food are called complex carbohydrates. Please add this in your two meals that you have. Okay, these fruits have too much of sugar, too much of glucose in it. Please avoid it. These are the oils that are ideal for weight loss, like olive oil, seed oil, vegetable oils. Okay, because they don't have cholesterol. Okay, because you will determine if the patient is at the risk of cholesterol related issues or not. If the patient is at the risk of cholesterol related issues, avoid animal products. Okay, have more plant based diet. Even if you're having non-vegetarian food, these are the ideal options of non-vegetarian food which you can have on a daily basis. Okay, so these are the applications which your client has to apply. Then practice. So practice, see, just by giving this guidelines and to-do list, to not to-do list is not enough. Okay, your client has to practice it. Your client, you have to make sure you have to be on call with your client. Okay, your client has to send you images of what they're eating, breakfast, lunch, dinner, what they're eating. They have to click the image of it. Okay, you have to encourage your client to maintain a food diary and share that food diary with you. Okay, so that comes into practice. Just by knowing all these information will not lead you to weight loss. Okay, you have to practice it. Okay, application has to be done of all these guidelines. Only then you can reach the goals. Then monitor it. Don't ask your client to send their weight on a daily basis. Monthly once is enough. Okay, monthly once, if especially if it is a female client, if she has started her diet on ovulatory phase, every ovulatory phase she has to send the weight. Okay, don't take the weight from she started her diet from the luteal phase, and you are taking the weight the next month you are taking the weight in the follicular phase. Okay, don't do that. When see in what phase a woman has started her weight loss journey or diet journey. Okay, what phase of the month she um, gave her weight to the dietitian. Every month during that phase you have to collect the weight. Okay, so more or less the body will be around the same hormonal impact. So that's how you have to help monitor your client's weight loss, and also not just weight loss, general holistic health. How the client uh, is the client more active now? Okay, after cutting sugar, is the client more active or more depressed? Okay, was there any signs of food addictions which has been resolved? Okay, these things you have to monitor. So coming to the underweight issue. So when your BMI is less than 18.5, that is what we call as underweight. Even in that you have various categories. Okay, like if your BMI is less than 16, severely underweight. If your BMI is between 16 and 16.9, moderately underweight. Okay, 17 to 18.49, mild underweight. Okay, normal range is between 19, normal range is between 19 to 25. Okay, that is the ideal range of a healthy BMI. So what are the limitations of being underweight? What are the issues that comes with being underweight? Your reduced oxygen capacity. Okay, usually people who are underweight, they are anemic. They don't have enough hemoglobin in their body. Okay, they're usually anemic. So when they're anemic, definitely their RBC levels are low, below normal. And if the RBC levels are below normal, oxygen capacity will also be very less. Okay, underweight pregnancy, that is more complicated. Teenage pregnancies, underweight pregnancies, if the woman is not of 45 kilograms. Okay, if the woman is not 45 kilograms, her weight is not 45. Okay, she is an underweight person, and underweight pregnancy will lead to, usually underweight pregnancies will lead to stillbirth, preterm babies. Okay, abortions, miscarriage. It's very common when it comes to underweight pregnancies. Then work off due to illness. It is seen that it's not obese or overweight people who are taking a lot of sick leave. Sick leave is very common among underweight employees. Employees who are underweight, they are not attending their work on a regular basis. Okay. Then increased mortality, death rate is also high in underweight people. Immunological effects, their immunity is pretty low as compared to healthy or overweight people. Delayed menarche, girls who are underweight, they will not attain their uh, puberty, menarche, the first time they get their periods, that is called menarche. That will not happen on time. Even by the age of 15 or 16, some girls have not yet got their periods. So that is a sign of being underweight. Okay. Nowadays, girls get periods at a young age of 8 and 9. Do you think it is normal or abnormal? In today's generation, girls are attaining their puberty as young as 8-year-old, 9-year-old girls. What do you think? Is it normal or abnormal? It's not abnormal. That's a myth. That's a myth that it's abnormal that girls as young as 8 and 9-year-old are getting periods. It's not abnormal. It is completely normal. Why do we think it is abnormal? Because we come from a generation where, and also from a society where female children, girls were not provided with good nutrition. It went to the boys. Okay. Historically speaking, it's a social factor. Okay. Girl children, while growing up, they were not given enough good food. Okay. The nutrition of the male child in the family was more in focus as compared to female child, even in education. Okay. But now things have changed. Okay. If you look at your own family, if you have Am I audible? Is my screen visible? Okay. So decades back, girls were not nutritionally fit even in their adolescent age. That was the reason why they were getting their periods at the age of 14, 15, and so on. But nowadays, there is access to nutrition. Okay. There is access to food, good food, nutrition, and at home, this bias of a male child and a female child has reduced drastically in urban countries, in urban cities mostly. Okay. If you look at your own brothers, sisters, or the way how you were brought up in your family, you cannot, majority of the general population will not see that my brother got more than me. Females usually these days will not say that. Okay. So, at least food wise, maybe education wise, or maybe property wise, that's a completely different discussion. But at home, when you see the food that was given to a girl child and boy child in the previous 10 years, okay, 10 to 20 years, in the previous 10 to 20 years, you will not see that kind of social discrimination. Okay. So girls, nowadays, the girl children we have, they are much more nutritionally well nourished. Okay. Yes, there is a pandemic of fast food and all, but at least they are nutritionally well nourished as compared to 30 to 40 years back, the same age group of children who were there. Okay, so that is one of the reason why menarche is happening at the right age. Menarche can only happen if the body is ready, it's well nourished. Okay, if the body is well nourished, only then puberty and menarche can happen. Yeah, it is capable. See, nowadays, if you see the advertisements, Okay, the way how advertisements of sanitary pads, okay, is telecasted. You will not see earlier in 10 years back, you will see a teenage girl having issues with her periods. But nowadays, if you see the recent advertisements of sanitary pads, it's young girls as young as studying in third standard, fourth standard, 8-year-old, 9-year-old girls are doing this advertisements. Okay. So handling menses, it's about, it starts at in your family. Okay. How the mother or the family members talk about menstruation. Okay, how teachers at school talk about menstruation. Nowadays teachers also have to talk about menstrual health. Okay, as an extra class they have to talk about menstrual health, give that health education to girls. Okay, these things, these changes are seen. It will slowly come into being, but a beginning is there. Okay, in the society. So when you talk about the diet plan, diet chart for underweight, okay, if you remember the first three steps, step one, step two, step three, it's the same. Okay, the steps that we have done in the previous calculation. But the step four, in we have subtracted 300 to 500 kilocalories. Okay, only that thing changes here. Here, step four will be add 500 kilocalories. For weight loss, subtract 500 kilocalories. In weight gain, add 500 kilocalories. Okay. At least 1 to 1.2 gram of protein per kg body weight. They have to add more protein in their diet. Fatty foods taken in the beginning of the meal. Okay. Because if you have more carbohydrate or fiber in the beginning of the meal, the person's stomach will be full. They will not have place enough to finish their meal. Okay, so fatty meal should be taken in the beginning. Salads, fruits and all you can have at the end. Okay, be liberal with carbohydrates, as many as possible. Be liberal with carbohydrates, and do not take fluids before meal. That is the opposite of what we will say to a weight loss situation. In weight loss, we will encourage them to have a glass of hot water before meal. Here, do not take any fluids before meals. Okay, so that's about underweight and obesity guidelines.